happening. Well, let's talk about this with Niall Dickson, who's Chief Executive of the NHS Confederation. Good morning to you, Neil.
Good morning.
Pleasure to speak to you again. There have been, a lot of figures that are thrown at us every single day in terms of hospital deaths. Now we've got care home deaths. Now we've got these weekly Tuesday figures with the Office for National Statistics figures. They suggested not only a big spike in care home deaths, but also that the overall deaths, particularly for England and Wales, suggested they were more than 40% higher than any other week, any normal week, the average recently, highest in 20 years. This suggests that there is not just a lot of deaths going on from coronavirus, which we know about. There may be many from coronavirus we don't know about. But is it also the case that some papers are claiming today that actually there are an awful lot of deaths happening because we are not actually tackling other health issues? 2,700 cancers missed each week as urgent GP hospital referrals are plummeting, is what reported in one of the papers today. Is that a concern?
Well, I think it is a concern. It's always been the case that we knew that there would be that horrible word, collateral damage, from, first of all, changing the way the health service works and really creating a kind of different and new health service, which was entirely focused, or not entirely, but very largely focused on treating and preparing for a huge surge in COVID patients. Now, I think that's been hugely successful. But on the other hand, we have had to stop doing a whole lot of things, and we talk about things like routine operations as if they're something that is almost unnecessary, and that's not the case. Of course, the NHS has kept going and has gone on treating the most urgent cases and things that are absolutely time critical. On the other hand, there are things that are time important that need to be done, and so people are still having strokes and heart attacks and all the rest of it. The NHS is open for business for them, but there may also be, as well as the things that the NHS has stopped doing, which may have an effect on the death rate over a period of time, there's also people's behaviour, and I think it is pretty clear that significant numbers of people are not going to hospital or are not seeking help. And the result may well be an increase in deaths. Now, we'll know more detail of this, of course, later on. I think the important point is the NHS at this moment probably has to start thinking about, right, we are coping with COVID deaths. How do we start rebuilding some of the more urgent stuff that we've not been able to do up to now? And I think that is what NHS leaders, our members, are starting to consider now as they start to switch. Quite difficult because they're still treating very large numbers of COVID patients, certainly in places like London.
Yeah, indeed. And this, of course, is part of the big concern, is that actually the focus on COVID may end up, and there's not just the economic consequences long term, but because of the focus on coronavirus, understandably, we may actually see other deaths from other people over this period of time, which wouldn't otherwise have happened. There is some concern that actually, we've got things like NHS Nightingale, there are a number of those now opened around the country, but certainly the one at the London Excel Centre, 4,000 beds. Reports today that actually some 30 patients had been turned away because specifically there was a lack of specialist nursing staff to look after them, and those patients are now in other hospitals, and most of them are on ventilators. Some have died, some have recovered, but they've actually now effectively rejected more patients than they've actually treated in total. Now, there's no doubt at all that building in that extra capacity with those ventilators, those extra staff, that was vital. If the peak ended up being much higher than it would appear, we don't know yet, it would appear it has been. There's some reports we've hit the peak 2 weeks ago today on the 8th of April, and I think we're all going to be keeping everything crossed that is the case. But we can't be blaming the government because it's got excess capacity. But is there now a very strong argument that all patients who are being treated for COVID, wherever possible, can be moved to these Nightingale centres around the country, if that is indeed at all possible to do, or all future patients be taken there, so that hospitals around the country can get back to treating patients as normal with the normal routine and emergency issues they go to hospital for?
Well, I think it may be different in different places. I think the argument in London is that there is a request going out to hospitals, and obviously if they want to move patients, they probably have to help by moving some of their critical care staff. The Nightingale's pretty efficient as a way of treating COVID patients because the nurse can look down a line of beds and actually have support staff, and there may be any kind of clinical support staff, but the nursing ratio of numbers of nurses to beds can be quite large. I think in the Nightingale it's 4 patients. Now, normal critical care would be 1. And certainly at the moment, the way the very stretched hospitals are operating, they may, for example, have a couple of beds which require a nurse for them in an operating theatre, which they've converted into intensive care. So people talk about, even the intensive care capacity within hospitals is not being filled. But, of course, we've got something like 1,800 beds in London. It's just vastly bigger. It's about 80% bigger than you would normally have, as it were. So they're not full, but they are, under some strain. If we were to move towards Nightingale approach, that would be saying, well, we need to probably move some staff, some critical care staff and other staff to help the Nightingale then do that. And I understand that is the plan. I mean, it's quite tentative at the moment. It's not huge numbers, but an appeal has gone out to other hospitals to help in that regard. In other places, I've heard, well, we don't want to use these facilities if we don't need them, and it's not a failure if we don't use them.
No, absolutely not.
People like me were accused, right the word go, saying the NHS can't possibly cope, you're going to fall over, you've only got X number of beds, you'll need 3 times X. Well, the system has developed that, and if we'd been more successful than we thought we'd be to avoid a super surge, and we have to shut these places down, then great, let's do that. It'll cost us money.
Yeah, absolutely. We should absolutely be celebrating these successes. Just finally and briefly, if you would, sir, I just want to ask you about PPE. The NHS Confederations among the bodies that have spoken out and said about, doctors and nurses and others on the front line getting shortages of PPE, and whether or not they should actually be able to say, look, I'm not prepared to treat patients putting myself at risk. Have you seen an improvement in the last few days since you've last spoken out in the supply of PPE? Are we getting on top of that?
Yeah, well, I've got 2 sort of areas. One within the hospital sector. Generally, yes, I think things have been better, but there's still this anxiety around gowns, and that there are differences. I spoke to Big Trust yesterday, which said, no, we've not really had, because we have reusable gowns anyway. They use, because they've kept open, which of course many smaller hospitals probably have not been able to do, but they've kept open a sort of big cleaning sterilisation thing. So they kind of launder the gowns and get them back in, and these are fluid repellent gowns. So they're able to recycle their stuff, and not all of it, they still rely on some of it. So there are places like that, and there are quite a few that are saying, yes, we are managing, it is all a bit still hand to mouth. So I think there's still concern, and obviously we were concerned when the promise was made of the Turkish flight, A, because it implied it was solving a problem and it was solving a few days' problem, and secondly because they were promising before the plane had arrived. And we said then, I'm not sure that's a really good idea, and then they said, oh, the flight isn't actually arriving, and then they promised that it would come again, it didn't come again, now it's come and it's half full. So I think the lesson there for ministers, if I might say, is to not make promises about PPE until the stuff has been arrived and checked, so that would be good. And secondly, of course, what we really need is a regular supply so that you take off this anxiety. And then the last thing is to say, I think GPs and care homes are the area we're really, really worried about at the moment. We've got to make sure the supply there is better. Again, I'm told there are improvements, that these local resilience forums, which are, like all the public sector coming together, are starting to distribute more effectively at local area. But I think it will vary, and I think there's still high anxiety among staff in all sectors.
Absolutely, I completely understand that. Niall Dickson, thank you so much for joining us as always, Chief Executive of the NHS Confederation.